All right. Well, hey, everyone. I think we're ready to jump in to this next webinar. And as you can see, many of you attended the last webinar called How to Survive and Thrive Working with Adolescents with Dr. Townsend. And this time we are, you can see us, you can see Dr. Townsend, you can see me and Madeline here. So I'm going to do some intros to let you know who we all are as we get started today. But we are really excited to bring you this webinar series. Today's is called Essential Skills for Working with Adolescents, and on November 1st, we are going to bring you underlying characterological issues that drive behavior, also with Dr. Townsend. So again, that will be November 1st. So we're really excited to bring you that. And again, so I am Mike Haarer, the Executive Director of Compass Rose Academy, and this entire series is with Dr. John Townsend. And Dr. Townsend is a psychologist, speaker, New York Times bestselling author who's written or co-written over 30 books, including the popular Boundary series. He's a top business consultant and leadership coach, leading people all over the world through his Townsend Leadership Program and training leaders and counselors through the Townsend Institute at the Concordia University, Irvine. So at Compass Rose, a residential treatment center here in Indiana, we've had the opportunity to work with Dr. Townsend for several years now, and he actually helped us build our model for treating teen girls ages 14 to 18. And we can just testify to the power of using his model that addresses not only the symptoms, but really goes to the root of the characterological issues. And so you're going to really get a sense of that today, as well as in future sessions in November. So we are grateful to have Dr. Townsend join us. The lady here to my right, or maybe on the left of the screen, is Madeline. She is our admissions director here at Compass Rose, and she's also an adjunct faculty member at the Concordia University, Irvine, and so she knows a lot about the character growth model and everything that Dr. Townsend is sharing about today. So we are excited to join you, but at this time, I want to turn it over to John, but I also want everybody to know, too, that if you have questions during the seminar at any time today, we want you to feel like you can be interactive. So there's a way on the GoToWebinar to enter in your questions. So go ahead and type those in, and we have question and answer time built in both at the middle and at the end of the webinar today. So with that, John, I'm going to go ahead and get it started and turn it over to you.
Thanks, Mike, and hi, Madeline, and welcome you guys that are here for the webinar. I really enjoyed it last time we did it, and have appreciated the questions and the comments and that sort of thing about it. Just on an intro level, when you work with people like you guys who have that sort of attuned sense and you're more emotionally sensitive, which you kind of have to be able to help adolescents, because you need to listen to what's underneath and listen to energy and listen to feelings and that sort of thing. I want to let you know that you might be hearing something different than me, and there's nothing wrong with what's going on, but you guys tend to be more attuned, and attunement's good. But unfortunately, my wife's mother passed away yesterday. And so it's a tough time for the family and a sad time, and everybody's rallying around. We've got a lot of friends that are helping out. But obviously, somebody I was real close to, and my wife is, my wife had a very, very warm relationship. So if you hear kind of an energy drop from me, I apologize, and just know that that's a reality. But the content here, I hope, will be helpful, and we've got lots of stuff we're going to talk about. All right, so just to get started. Now, Mike, as I understand it, everybody that's here on our viewing and listening audience here in the webinar, they can see the PowerPoint that you're like scrolling through, as well as your face and Madeline's face and my face. And Madeline's face is better than your face and my face.
Yes, I think everything you said is true. Yeah.
Okay. So our video things are on the top, and on the bottom, people can see our agenda.
Yeah, and I think people should be able to maybe move around our faces to kind of get them out of the way of the words if they need to.
Okay. All right. Well, yeah, the way that Mike and I conceptualized this, guys, to be sort of a trilogy. We did the first one a couple months ago. This one is really on skills. This is sort of what a kind of like, once you understand the theoretical concerns of working with adolescents, What are the particular skills that help them to be where they need to be? And so we're going to do this in an interactive fashion. And by the way, since we do believe in interaction, and the worst thing you can have on a webinar is a talking head just sitting there spewing out content that just is a snoozer. So not only are me and Madeline and Mike going to be interacting on the content, but also going to give you guys time and space for your own questions halfway through and then all the way through. Should make this something that you can have feedback in and have your own particular questions answered and that sort of thing. So to introduce this, I need to go back to an occasion that happened a few weeks ago. As Mike mentioned, there's an institute, the Townsend Institute of Leadership and Counseling at Concordia University in Irvine, California, where I am. And Madeline was down there teaching and a lot of us other faculty. And someone came up to me and we introduced herself and I said, "How are you doing?" And she said, "Well, my daughter just came out of Compass Rose Academy. She had been there a couple of years and she is thriving." And I said, "Well, fantastic, that's great to hear." And I always ask kind of like what made the difference. And she just said a lot of this was that these people, they didn't just kind of tell my daughter what to do, they understood her. And so that's really a key mark of anybody working with adolescents, whether you're working in a residential treatment center where Mike and Madeline work, which is where the intense, more severe stuff is, or something where you're, maybe you're an adolescent or a teen pastor at church, or maybe you're just a volunteer trying to help out, or you're a therapist doing outpatient work. That's going to be a big part of this. I believe that we are healed to the extent that we are known, and you can't heal anybody you don't know, and you can't heal anybody that doesn't know that you know. A lot of people say, "Well, yeah, I understand kids," but when I talk to the kids go, "They don't understand jack. They tell me that they understand, but they don't understand." So one of the big rules of working with adolescents is to make sure you convey to them what you think they're saying, and then to say to them, "Do I get it?" And if they're an adolescent, 90% of the time they'll go, "No," for various reasons. You might not get it, that's one reality, but the other reality might be that they're pushing back on you in some kind of a protest fashion for their own individuation. But until they say, "Yeah, you get how I feel," you really aren't at first base. So remember, it's not just listening, but you've got to know that they get that you're listening and that they do get that, do get it, and they convey that back to you. All right, which leads us to part one here. Ally with them versus the parents while staying connected with them, with the parents. Well, that's really difficult. I mean, think about the oxymoron there. You've got to ally with them because they don't think their parents understand, unless they're really a masochistic, non-individuated adolescent who's sort of self-hating and is afraid of, pushing back and this sort of thing. And so they're very allied to the parents, like a severe anorexic most of the time. Sorry, they won't push back when they need to. That's part of the job. But 90-some% of adolescents, they need to know that they don't think their parents are doing a good job. They're too controlling, or they're self-centered, or they don't want to allow enough freedom. And you've got to ally with that feeling and that experience. But at the same time, you've got to be connected to the parents. One of the worst things I've ever seen with adolescent clinicians is when they make the parents the demons. And then when they sit down with the parents say, "Well, I hear you're telling my kid that, I'm a control freak and I don't understand you." And if you have to say yes to that, all of a sudden the parents go, "Are you trying to divide our family?" So one of the how do you say it? I think one of the most nuanced skills you can have is to really be empathetic with the child when they're in the session with them without the parents, and say, "Yeah, it does sound like they're control issues, but I always stay with the adolescent's experience. Sounds like it feels. Sounds like that's your experience, because you really aren't in the room with them. And then when you get with the parents, you can say, "Now, look, I need to tell you, a lot of working with your adolescent, yes, your adolescent's got issues, but I always say, I as a parent certainly contributed to where my kids were and this sort of thing. So I want to know what you can own." So big beginning point is you really need to let the kid know that you understand their parents weren't perfect and where they weren't, but also let the parents know, "I'm for you too. I'm trying to win for everybody." These strategies, as you can see in your notes, they're based on the attachment and affective neuroscience research that shows us that the change in healing best happens in the context of an attachment relationship that focuses on the affect. And I wanted to stop there for a second. Mike and Madeline and I and all the professionals at Compass Rose are really excited about all of the neuroscience research that's coming out now, because basically what it says is it's all about relationship and it's all about emotion. And you can, and that's why we love the cognitive stuff. And there's a lot of principles and skills of right living and how to make great choices and how to make wise choices and pick good friends. You've got to have the cognitive, what we would call the left brain stuff. Actually, it's not really left brain, but right, we found out. It's just, let's use that word anyway. But you need that left brain stuff. But if you don't start with the right brain stuff, with how you're feeling toward them, and especially how they're feeling toward you and their parents and their friends, the brain just doesn't work. The brain is we have a holistic brain, especially the adolescent's brain. So pay attention to feelings, pay attention to relationships. These combinations been best create new neural pathways that rebuild character structure in the client, meaning this is the really big aha. I think I mentioned this a couple of months ago. We found out that the app can really change the smartphone. If your brain's a smartphone that you can hold like a device, this is a device. The app that I got a bunch of apps in there for different things. The app is the relationship and the experience and the feelings. That can really change and improve the brain. We never knew that. We thought that the neural pathways are locked in. They'll always be the way they are. They're static, and you can't change them. Your brain is your brain. Not true, which means in adolescent treatment, that the way you experience them and helping them with the intense emotions and the scary emotions and the emotions that they're ashamed of, and you're there and you've got good eye contact, you're not afraid of that stuff, it actually makes the brain work better. And then finally, allying primarily with parents, will reinforce negative parents and create distrust. So, and I talked about this a couple months ago about stay in a neutral zone. It's inside the adolescent. You don't ally with just the child part or the parental part. You do the same thing in the relationship. If you're there as the representative of the parents, well, your parents told you to take out the trash, and I understand you don't do that. And you look at all your parents did for you. You don't get anywhere. So, Madeline, Michael, you've got lots of experience with that. Any thought about this first part?
Yeah, I think, like you said, we don't speak in terms of, well, I'm on your side or I'm on your side, but when you do ally with the child and you, like you said, build trust with the parents as well and kind of relate to that part that says, hey, this isn't about you've made all these mistakes, but we all make mistakes as parents, and we're going to work together to kind of help create this healthy family system, and kind of you build buy-in with the family. You can create that feeling that they both feel like you're on their side, even though it's really not necessarily about being on a side, but you kind of create that feeling that, hey, they're with me in this and they understand me, and we're going to work through this together.
Yeah, I was just talking about that earlier today with our enrollment coordinator, just that need to, and I love the way you said it, that we're healed to the extent that we're known, and our clients are not known, our students are not known if we're not allied with them. There's no way for them to be led into these deep affective experiences that are going to rewire the brain if they don't trust you, if they don't know that you are on their side, like that you know of them.
Yep. Now, I would say rule of thumb, guys, and is just to remember, there's no way you can be perfectly in the middle of the needle between allying with the parent, allying with the team. No way. I mean, nobody's 50-50. When in doubt, ally with the team, because that's your client. That's the person who needs the help. That's the person who needs your expertise. I mean, you want to keep it as close to there as possible. But when in doubt, you might have to say sometimes, yeah, it sounds like they really didn't get it, or it sounds like your dad's passive and your mom's sort of all over in your face all the time. And it sounds like it's true. And you have to tell the parents, your kid's not going to get well until we know the mistakes you've made, that you're not ashamed of them either, and that sort of thing. So when in doubt, it's got to go. The client is the child.
Yeah.
Yeah.
I was going to say, I think that this client doesn't necessarily even know the difference between you being on their side and you attuning to them. you're not necessarily saying, yeah, your parents are jerks, but it really feels like, and as you're attuned to them, they might think that you're on their side. Either, they might think that you align with all of their views or not, but as you're attuned to them, that's what they feel, is that you're for them.
Yeah, and attunement doesn't always mean agreement, but, and I've had to have to say sometimes after I met the parents, and then I got, Jimmy in the office, I had to say, I'm glad to tell your parents this too, but I do think they're too rigid, or they're split where one's all love and one's all structure, and I'll say I'm happy to tell people that, because if I don't tell that, the child feels like they're crazy, and I don't want that to happen. All right.
And I was just going to say, I think that a big important part of being able to ally with the child and even challenge the parents is working through as a therapist. If you have your own family of origin issues, parent issues, adulthood issues, competence, then that is an issue that, as you kind of address that in yourself, you are better able to challenge the authority figure in the family system when you need to do that. And that can be very important and necessary at times.
Absolutely. All right. Next. Oh, I love this. Empathic attunement. And Madeline and Mike both used that term a lot a few minutes ago. The ability to hear, see, sense, interpret, and respond to the client's verbal and nonverbal cues in a way that communicate to the client that he or she was genuinely seen, felt, and understood. This is by Wiley and Turner. And basically, what we've learned, everybody knows that an adolescent needs empathy. Which is to be able to, have some sort of experience of what they must be like in their shoes. But attunement, I believe, is much more particular, because when you're attuned, it's like when you tune your, I was going to say turn your radio, but what's a radio anymore? But when you tune your channels on your TV or whatever, and you go to a particular one, really good adolescent therapists can attune to, well, something just changed there. You just checked out, Susie, or there's a tear here, or you got mad, but you seem sort of sad inside, and you can attune to the various changes within the session. This is so powerful, because the adolescent, as you know, if you work with adolescents a lot, they have a multitude of really scary emotions that are out of their control, and they feel like in the middle of a storm, and yet the storm is inside you. You are the storm, which is horrible. But if you're attuning to that, you're saying, I can talk about it, I see it, I observe it, and that really helps. It's a wonderful quote. What's our next point? Oh, that's it.
Yeah, so, and John, I would even ask, going further with that whole idea of attunement, I think, can you explain and just describe a little bit further, what does that really look like, as opposed to, a lot of good counselors really know active listening and reflecting and all of those good counselor skills, but what is really the importance of attunement? What sets it apart from all those good counselor skills that we think of like that?
I conceptualize attunement as a specialty subset of empathy in general. We were created to bond, right? Humans are supposed to bond as well as a lot of the higher level animals. And attunement is when I can throw out all the noise in my head, whether I had a bad day or a fight with my spouse or whatever. And it's a lot of work, by the way. 2 minutes is a lot of work. And it's two things at once. I can go to the one emotion at that time in a 50-minute session, a 45-minute session. I might attune to, 15 different feelings. That's a lot, but I'll generally attune. With an adolescent, I'll attune to probably 5 or 6 or 7, but sometimes up to 15, where I see the thing shifting, and I just don't say broad things like, sound like you're upset. Well, upset's sort of like easy, that's like not a lot of work, but it sounds like you really don't like yourself right now. That's very particular. Or it sounds like you really judge yourself, or sound like you feel like everybody's after you, or nobody understands you. That's why it's really good to have, I think, a good vocabulary of emotions. I have an assessment device we just finished and put on the web, the Townsend Personal and Relational Assessment Tool. Madeline's been through it. In the TPRAT, at the end of it, I have 116 emotions because people need a better emotional vocabulary, especially adolescents. And I have them categorized in 10 categories, like anger, upset, negative feelings towards yourself, positive feelings towards yourself. Because if you're going to be an attuned person, your adolescent probably comes in with 3 words. You know, everything sucks and you suck. I mean, that's 3, that's 2, but and let me out of here, right? They need a more nuanced emotional vocabulary. So attuned therapists they have a very rich emotional vocabulary. So that's part 1, is the particularity. But the other part is the matter of, I guess, what I would call manifest versus latent feelings. Manifest feelings are that I'm really mad and I don't like this place, I don't like you, I shouldn't be here. Underneath there is shame. The more vulnerable feelings, like something's wrong with me, I'm scared, I'm not happy. And so attuned therapists, they certainly understand the manifest feelings, but it's the good ones can attune to the underlying feelings driving everything else. So particularity and latency. And then this part here where it talks about attunement to special resistance. You know, guys, this is what cuts the mustard between a decent adolescent therapist and a rock star. Is it's easy to have somebody say, oh, my therapist loves me and they are a kumbaya and we just hug all day, emotionally speaking, and they get me. Well, you're probably okay, but that's not where the great therapists are, that 10 years later, they'll come up to you at a shopping center and say, you saved my life and I'm a great parent now and my kids are great and thank you. But it only comes if you can deal with attuning to resistance. Now, what is resistance? Well, resistance has to do with defenses that are activated within the therapeutic structure. You don't have resistances in the shopping center or on the skateboard park. You have resistances within the session itself where you can actually look at them. And when they're mad at you and you represent they don't have freedom and you're a narc anyway and they got nothing to say to you and you're not cool and you wear weird pants and you're trying to be cool but you're not really cool, and the therapist that tries to be cool and is not really cool is the worst therapist of all, then a parent therapist that says, I'm sure I don't understand every song you know, it's okay that I don't. I'm not going to try to learn every song and learn every hip hop and death metal lyric. I'm not going to be that cool. They're going to hate you because they don't get well until they hate you, because they've got to deal with what they're feeling towards their parents and then move towards attachment and love and grief and then metabolize and grow up. So you can't be put off by the hatred and the scorn and the contempt. And adolescents can be so precise. If you're balding, they'll go after that. If you're overweight, they'll nail that. And if you stutter, you got to go home and get your own therapist. But they got to have a place to do this where you can say, yeah, I am kind of overweight and bald. What do you think about that? Is that hard to be around an overweight, bald person? And you keep attuning. Now what you're doing on a structural level is not only are you tuning to the need and the scared part that you want to kind of support, you're attuning to the rage and the pushback and the flipping off life. You are integrating them, and they're feeling like somebody understands my good side and my bad side. Somebody understands my need and my anger. Somebody understands my need for love and my need for freedom and autonomy. Somebody understands my need to obey the rules and be a good kid, and also my need to be as rebellious as I'll get out. The ones that can attune with resistance and don't take it seriously, you will get that thank you note 10 years from now. Guys, thoughts about that?
Yeah, I wanted to have you even go, because you were starting to talk about integration and kind of how this attuned therapist can, take that beyond just dealing with the anger in the session or the anger toward parents or whatever, and really begin to integrate that resistance and the anger and the frustration and all that stuff. So I know we're going to talk more in the third one about really the characterological underlying issues of treatment, but you're kind of, starting to kind of mention that. I just wondered just a little thought on how, the difference of that approach, a therapist that really attunes to that resistance in session versus maybe the hang up that a therapist might get into what might a novice therapist or one that's not really attuned to these issues kind of do that would go wrong there?
Generally speaking, they'll try to talk them out of the negative because they don't want the child to be self-destructive or other destructive. So they'll say, well, is it really reasonable to be that angry right now? I mean, that anger is really not good for you because, you might make some bad choices. It's absolutely true. It's absolutely true. But they really can't hear that because you're only talking to half of the person, right? You're talking to the person that does want to make good choices and does want to, obey reasonable rules. By the way, that's not the part of the child that's in the office. That's not why they're there. That part's kind of okay already. But there's another, what we call split off or disconnected or unrelated to part of them that's very resistant to all this. And if all you're doing is trying to tell them that positivity is the only way to go, and there's no room for them to talk about negativity and hopelessness and that sort of thing, then what they're hearing is, you want half of me, and another half of me is either scary to you, or you don't like it, or you judge it, or whatever. And so some really smart, sophisticated kids will just go into the compliance mode with a novice therapist and go, okay, I'm gaming the system here. If I say things like, yeah, you know what, I really do need to be nicer to my friends. That's really helpful. I think drugs are a bad thing. Wow, this is revolutionary. Thank you so much. They're seducing the therapist into believing that the compliance is internal when the compliance is just external. So watch out for that, as opposed to when they say, I don't like what you said, or I need to talk about this, I can't tell anybody about it. So then what was split off is then made relational. And we'll talk about this, as Mike said, at the characterological piece next time. But most of the time, their heads are fragmented into other pieces of anger and loneliness and scaredness and all this. You're the person that integrates into one place. Don't get seduced. And then I love these quotes down here. Dan Siegel says the most important element in an attachment-based, neurobiologically savvy therapeutic approach is the requirement that the therapist feel the feelings, not merely understand them conceptually, which we kind of addressed before. It's actually, you have to feel them. By the way, get in your own therapy. An adolescent therapist, or even a lay counselor or somebody in the pastor, get in your own therapy, because it's going to bring out adolescent parts in you. And make sure you're healthy, because you can only help them to the extent that you've been helped. Go get the therapy, because then you can feel it. In addition to attunement, we can step back and do some meta processing at times. That's thinking about thinking or processing about processing. For example, I know it's hard to hold on to those feelings when those around you think they're silly, but they're still important to you. And refrain from advice, especially while building the alliance. Those are just good things to remember. All right, guys, know your adolescent neurological development. Where is the executive functioning at this stage? Sort of pathology from normal team functioning development. Look at the reward pleasure center of the brain. Mike, do you have the diagram that has the different pieces there so we can point them out?
I do not have that diagram on this one. We referred to it last time, and you talked about your kind of the fight, flight, freeze, or fold, but we don't have that on this slide.
Okay. Executive functioning, I mean, look, guys, look at this diagram as, I'm going to say that the top of it is the front part of the brain, where their face is and their nose is, and the back part is the back where the back of the neck is. And look at the front part, around the front part, a little bit lower than the very top, as the prefrontal cortex, and that's where executive functioning is. And that part of the team is very undeveloped. We found out that in adolescent girls, it probably cements into where it needs to be neurologically, I don't know, 19-ish. It goes back and forth. With boys, a few years later than that, their brain just solidifies later. No surprise there, right? And then sort of pathology from normal team function development. And the reason we have that, guys, is because a healthy team is still going to be crazy. They're going to push back. I mean, and it's earlier than it used to be, probably at around 11-ish now. They're starting to push back, have defiance, either manipulative defiance or direct defiance, outburst, questioning of the rules. the argument that never ends, why, because it's really not an argument about truth. It's about, I'm just going to keep hammering you like an attorney until I get my way. That's all normal stuff. In fact, if you don't have pushback, like when I wrote Boundaries with Teens, I talked about the normal pushback that a teen has. If you don't have that, you've probably got a problem. And I remember my wife and I, we raised boys. My wife and I always felt really insecure because our kids were getting into trouble in those years, our boys were. And then we had some friends around us that had, you know, the perfect kid like Poindexter, you know, and he always had his shirt like this. And he was, can I go get your coffee now, mother? I mean, that kind of kid. I mean, just, I could not relate to him. But, you know, their parents were always, oh, so sorry, your kid was in detention. Yeah, Poindexter's probably going to Harvard next year. And we were like, we're like the worst parents in the world. And then, guess what happened? Well, Poindexter went to college and, I mean, you know, frat parties and craziness and trouble and losing grades and, you know, all this. Why? Because he did not go through a normal age-appropriate adolescent development when he should have on time because his parents needed him for whatever other reasons to be perfect. So the goal of a parent is to go through the adolescent part where you can be with them as much as possible to monitor that and structure it and love them through that and give them appropriate consequences and be on their team and get to know them so that they get out and college and they don't go too crazy. Now, that's normal. What is abnormal or what we call pathological? Mainly it's in terms of two things. One is severity of symptomatology. That's where you go in a group like Compass Rose. They're the best in the country as far as I'm concerned. Everybody else in there is just goes, gosh, thanks for that time we spent with our daughter. Severity, which means, you know, drug problems, alcohol problems, violence problems, self-harm issues, mutilation, cutting, conduct problems, ditching school, runaways, this sort of thing, violence. When you realize basically that the home that you have does not have enough structure for the home, you got to send them somewhere. I saw a couple last week where their 16-year-old, after multiple attempts, said, I just don't believe in these rules and I'm bigger than my father now. And they did consequences and taking away a phone and all that sort of thing. And the kid said, I don't care. I don't feel remorse and I don't mind hurting my siblings. And you can't do that. And so I had to sit down with them and make it. They had a very, very close family. I said, he's not going to be able to be with you guys for a year. You've tried outpatient counselors and you've tried, you know, support, you've tried great limits, you've done everything right. He's just basically telling him my problem is so severe that the structures you have here are enough. I'll just break out of the windows and go do what I want to do. And now things are going to be fine. So look at severity. But the other thing you look at is longevity, chronicity. If the kid has an outburst, but then you can get it solved by appropriate love and limits, then that's a different thing. But over a period of time, you're not doing the child any good. So you look at pathology in terms of severity and chronicity over time. And then the reward pleasure stimulus of the brain. Well, just look at it this way. As the prefrontal cortex for thinking and judgment and, you know, thinking about the future and future anxiety and planning, as that's too small, guess what's too big? Reward pleasure. You know, they want pleasure. They want to feel good all the time with devices or friends or substance or whatever. And so this has got to win and this has got to lose a little bit, but you got to pay attention to it.
Good.
Now I've got questions halfway marked now on my notes.
Yep, so we've got this last slide here, if you want to do that, and then we'll take questions. So if people just want to take a moment and just kind of think through, we're starting to get some comments, so just throw in some questions and we'll get to those here in a minute.
And remember, guys, when you work in adolescence, me and Mike and Madeline know this is a shame-free zone. So if you think you got a bad question, just write down, I have a friend who has a question, and I'll take good notes and give them to my friend. Nobody will shame. All right, so use questions more than dispensing information. Take a collaborative approach where the client is an active and significant part of the healing process versus an expert therapist to teacher approach. Wonder aloud instead of asking closed questions. Number one, this is just good in any kind of psychotherapy, no matter what developmental stage, with a child, adolescent, adult, whatever, is that if what they needed was information, they probably have it now. They just go to Wiki or go to, some website or ask somebody a question. So don't look at yourself as a teacher. Like, my wife's a lifelong educator. She's been teaching in the public school system here in California for 30 years. And so she's a much better teacher than I am, because she knows what the information is and how to say it in a way that makes sense and this sort of thing. And so I kind of like worship her on that end. But therapy can't be teaching. There's a teaching aspect, but therapy has much more to do with, once you attune to where the adolescent is really feeling things, especially either in not connecting and not attaching, or not feeling like they have choices and power, or feeling ashamed and condemned and judged, or feeling like they're not ready for the world and not ready to kind of like know what their life purpose is and all those higher level things. You notice it by attuning. You put words on the feeling, then they begin to say, oh, this person knows what they're talking about, because they're putting words on something I don't have words for. And then you begin to wonder, and I probably need to stop using it, because nobody knows who Columbo was, but there was an old TV show with a detective, Peter Falk, and he would always say at the end, sort of the end of the show, when, he knows the butler did it because the butler's got a bloody knife, and there's no question about it. But he goes back to the butler and says, so I'm just kind of confused here. Is that ketchup on your knife? And then, the butler freaks out and runs down the road, and they catch him and all this. But it was always this wondering thing, which is much different, because again, think about the protest level adolescent. Their job is to take you off the throne. Their job is to say, you're not as smart as you think you are, and you're not my authority. You are not my parent. You are not the boss of me. And even though you are, they got to get to that later. Their job is to push away all authoritarian expert stuff. So stay away from that. Do you know how many degrees I have on my wall? Bad idea. Much better to say, I'm wondering if it feels right now that, even though you feel really kind of assured of everything, that everything we're doing here is lame, if you're a tad overwhelmed at all this. First time they'll say that's crazy. Second time they'll say that's crazy. Third time they may tear up and say, yeah, I'm overwhelmed. Your job is to wonder with them, and then at some point, they feel like they're part of the process of being able to state what they feel. Sometimes the adolescent will say it first. That's maybe 10-20% of the time. Most of the time, a good therapist will say, so it really seems like, if I'm hearing what you're saying, that what you told me about your mom and your dad is that you have felt like you had to be the parent in your own home and be the smart one, and that really weighs on you. And then you see the feelings, and then they'll take that. Well, yeah, I can tell you 3 or 4 more examples of that, but they have so much more buy-in to that because they were part of the process. Most of the time, you'll get it because you're the expert. They'll follow with feelings and examples in your mind.
That's great. Well, John, we are starting to get some good questions here, so I'm going to shoot some your way. The first one here is, can you give an example of how to attune with the split-off adolescent who is engaging in risky behaviors, but being careful as the therapist not to condone, but also not to preach at them, not causing further splitting? So how do you attune to that adolescent?
So, Sarah, as I understand that you've been doing this quite a bit. You've been involving yourself in the drug culture, sneaking out, and getting and becoming sexually active with boys, and that's something that we don't have to like argue about because it's a fact and all that. And you are telling me that it's okay and it's not that big a deal, and people would just leave you alone, that you keep doing that. So it sounds like to me what you're saying is, I'm pretty much in control of this, and that sex, drugs, and acting out and sneaking is something that I'm choosing, and it's not really a problem. Do I hear you right? Yes, you're right. Okay. Then I move to, I understand that. I understand that you want to have your own life. I know you're 14, and I know that you can't make the choice you need to have legally, but I understand you want to have your own life. I understand that you can't make the choice you need to have legally, but I understand you want to have your own life. I understand that you want to have your own life. I know you're 14, and I know that you can't make the choice you need to have legally, but I understand you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. I understand that you want to have your own life. as you were talking about what it was like and how much fun it is with those folks and then having to come back home, I saw another part of you. Do you mind if I give you some feedback on what I saw? Yeah, whatever. It seemed to me that part of you really wanted mom and dad to be a bit more concerned, like they were so whatever with you and gave you a lot more permission than you thought you should have. And I know you don't like it that they have you now seeing me, but there for a long time you kind of felt like, where are they? I'm trying to get their attention and they're busy and she's got other kids and he's got a career or both or whatever. Felt like it was almost like you wanted them to kind of be around you more. Well, no, that's not what I care about. Okay. That's attunement number one. And with adolescent, I'll do the same one in a different color 2 or 3 times. And it may not be in just that session, guys. You got to be patient. But that's a lot of times in that second session, maybe the third session, they'll go, well, yeah, it'd have been nice if they'd been more paying attention to me. Then you're getting somewhere. That'd be an example.
How about icy silence? We have a therapist that says he works with counselors who just mentioned that they're greeted with an icy silence from clients who just refuse to engage. What do you recommend for that issue?
Well, there are 2 schools of thought really on that. One of them is, well, there are 3 schools of thought really. One is to be the social host, which I think is really not a good idea. What do you want to talk about? Let's talk about your folks. Let's talk. You have hobbies? Are you depressed? I mean, I just think, if I was a kid, I'd just sit there and say, what an idiot. I think that's taking way too much responsibility for the child. And it's mainly just diversion, and it's really mainly just based on therapeutic anxiety, which is that I really can't stand silence. And if you can't stand silence, you got to go back to your therapist and find out what that is. We need to be friends with silence. Number 2 is the power move, which is to kind of sit there in the analytic position and just stare at them. And I've never seen that. I think that's better than the diversion, but I think they're not going to read into that. Gosh, this is for me, and you really want to make me that space. So after about 10 minutes, they're going to go power struggle. I can win. I can do this all day, standing on my head. What I prefer, excuse me, is to make the silence the issue. Is to say, you're really quiet. Why would that be? I don't have to tell you anything. No, I know. You don't have to tell me anything. But, it's just a long session, and I'm concerned. So why the silence? And if you press into that icy silence enough and you're warm, unless you've got a really, really severe kid, then, well, let me get to that in a second. Most kids, after a while, will go, well, because you're an idiot. That's why I'm silent. Or because I haven't been made to do this. And then more, if you get one thing, I mean, they are throwing you a bone right there because you're an idiot. I'm so glad you said that. I know a lot of people say I'm an idiot. Anyway, so that's the best way to handle it. So you must feel like a lot of like anger and sort of contempt for a person like me. Well, yeah, now you're on the way. If it continues with icy silence after all the what I did with that third approach, I think you probably have to let them know some reality, like I understand you don't want to be here, and if you don't want to even talk about the silence or the why or that sort of thing, probably your parents will go to another more serious move, which I wouldn't want you to do that, like send you to somebody like me 3 days a week or going to residential or whatever. And I don't want that to happen. So, then you just appeal to their, well, I got to do my time. I got to make the most of my time. But you got to be realistic. If you're not talking, Sam, I can't do anything with you. So, and I don't want you to have to be ratcheted up to another level of severity. That'd be awful. So it's kind of in yourself, in your best interest. So that's 1, 2, 3. That's 3 approaches, of which the third one has 2 parts to it, depending on severity.
Let's do one more and then jump back into the slides. We have a question. You had mentioned earlier about adolescents internalizing consequences rather than just relying on external consequences. So how do you accomplish that with a child who's been used to just external consequences, and so they've learned a pattern of behavior to just become sneakier? How do you help them to internalize those external consequences?
Most of the time, the adolescent who kind of can play the game, like prisoners play the game and that sort of thing, they can't keep playing the game, because if they could keep playing the game, the parents would yank them out of counseling, right? They'd say, oh, they got good grades, they got good friends, they're polite, they're nice. So the way that we're structured internally, if we don't have integration inside, meaning if we haven't internalized the right amount of attachment and structure inside, you can't stop the impulsivity. You can't stop self-harm. You can't stop defiance. You can't stop using. You can't stop conduct problems, that sort of thing. So you really got to take a two-pronged approach with the compliant person. The first thing you try to do, I think, is to head it off at the pass. And when they say, oh, okay, so I need to start going to bed, my parents say, okay, can I stop now? What I just try to call it and say, I think you're a lot smarter than you're saying, and you know about going to bed at night. And I think you reached that conclusion way too soon. It feels to me like you're just trying to give me the right answers so that you can go back home and not have to worry about all this. And I think you probably have some negative feelings, like fear and aloneness and not feeling understood. And I'll just give them what I would call a menu, because adolescents aren't that, especially boys, aren't that able to have that emotional vocabulary. It seems to me that you're isolated or feel scared or feel not good enough or whatever. And I'd rather you talk about that. No, I really get it now. Do my homework and go to bed at 10 and don't hit my sister. Yeah, I just think that's not really going to work. I mean, we're supposed to do that, but you haven't talked about all the things we've seen in your history and what I've even heard from teachers and parents and that sort of thing, that you're not really happy. Or there's a certain amount of kind of like self-absorption, really, that you kind of think it's all about you, and we all kind of do, but I think it's a big problem. No. Remember, everything's mild to moderate, severe in the world. So mild to moderate will say, after a while, okay. A severe will go, no, everything's fine. Then what you have to do is tell the parents, you can keep them seeming, and I would suggest that, but she is in a compliance mode right now. But since she hasn't chosen to open up about any of the issues now, I kind of predict you're going to have conduct problems within a couple of months. You can either just wait and bring her back to me then when the acting out happens, but it's going to happen. And so either keep with me and I can keep working on that and give the parents the choice. But it's like a steam engine. You're not going to tell that steam engine, that's just raging and sad and all that, stop working. Compliance never works. And so it'll come out of some kind of acting out or acting in behavior because the structure hasn't been internalized. Once it's out there, then you can say, okay, you messed up again. Were you scared that time? Yeah, I was insecure. I want to impress my friends. Okay, let's talk about it. Then they internalize the consequences.
That's good. I feel like that kind of can segue a little bit, John, into we started out talking a lot about the attunement and that relationship building and the alliance, and then shifting to when do you begin to question, challenge, interpret? So can you kind of shift into that a little bit for us?
Yeah, just remember this. Nobody listens to anything if they don't feel understood. I mean, a cop got me the other day because I was texting, and I stopped and I changed my ways, and my kids, righteously, busted me, and that I shouldn't have been. I was texting at a stop sign, which I thought was okay, but it wasn't okay. So he pulls me over, and I'm mad at myself, and I'm mad at him, and I'm mad at the world and all this, and he's giving me this lecture about safety. Do you think I heard? I mean, it was all right. He's right about everything. I didn't hear one thing he said. I just wanted to get out of there. Now, he didn't have time to attune to me, and, cops' job is not to attune in, it was to keep us killing each other, right? But think about the adolescent. You have to earn the right to say, this isn't a good idea. This is that part of that self-destructive as we talked about, when you get scared and you act out, or when you you get into that space where you can't have problems, you got to be perfect, then you do something self-destructive because you don't feel like you're real. That's why you cut, because you feel like you got to be the perfect person, but this lets you know that you're really in pain. And you begin to do that and say, there are better ways to do this as long as we understand what's underneath. They can listen to it. So you have to earn the right. And again, like Mike said at the beginning, you got to have them say, you get me. Never ask an adolescent, well, did I really get the bullseye? Because they'll pull a power play. No, you don't get the bullseye, and you'll never get it. But yeah, you sort of get me. If an adolescent tells me you sort of get it, that's a home run. Guys, thoughts about that?
Yeah, well, I was just going to ask kind of a follow-up or maybe clarifying. Can you talk about how this is different at this stage, this observing or interpreting? How is this different than a therapist that is super directive or advice giving or almost preaching, lecturing up front? So what's the benefit of this kind of style of observing and interpreting at this stage in treatment a little later on?
Well, when you're talking about, again, mild, moderate, severe pathology or severe crisis kind of stuff, we're all the same. It's a triage. I mean, you don't go into ER with arterial bleeding and somebody asks you about your feelings. They hook you up and they strap you up and they stop the bleeding and they bring in the codes, right? So with stuff that's life-threatening or, really destructive, we're all therapists are the same. We all have protocols. But in terms of when the child is safe and they're not in any kind of critical danger, the difference is the one that I think the difference is the adolescent therapist who feels like that the child is more able to handle reality and cognitive constructs than I think they can. Number one, nobody can. But number two, especially the adolescent, has got to feel like somebody's on their side, especially in that more vulnerable place that nobody likes, especially authority figures like. So the one that doesn't understand it and thinks that they can metabolize reality and can metabolize advice and can metabolize suggestions. I think that their thinking is that the adolescent is much more able to take in data and objective facts and things like, well, just say no. And do you know what the statistics are about venereal disease? They know all that. They're on YouTube all day and Instagram. So the difference is that there's a difference, I think, in which therapist thinks that they can metabolize hard data versus those that go, it's going to be a while before they can even take feedback from me, much less hard data. And I would say that Compass Rose and me and you guys are all in that camp, that second camp.
That's great.
Be the relationship that you want them to internalize. They're taking in your warmth and support and challenge in the here and now, and then they take you with them into other relationships outside your office. Potential space, champion new ways of being and relating, and knowledge, validate, and amplify healthy responses. The point here, guys, is that the only way an adolescent makes it to adulthood, remember I said the last time at our first webinar, you got to keep the future in mind. This is about making them as healthy adolescents as possible, but it's really about you're helping this oven of growth to be the right oven for somebody in their 20s, 30s, 40s, and 50s, and so on. And so they have to internalize a healthy person. Now, they've internalized, taken in as psychological entities and realities. That's what internalization is. They have taken those in, their friends and most powerfully their parents already, but they have not taken them in either as the right thing or their parents haven't been what they need to be. So you've got to not only help them to be warm people, you've got to be that person, because the more you attend to them and let them know you understand the scary stuff and the alone stuff and the hard stuff and all that, then, and you really mean it and you're authentic about it, it's not just a bunch of words. They're not just listening to like a list of, okay, this is what a person is, this is how a healthy person is. It's not that way at all. They're starting to go, that felt good. That felt safe. She's like, she gets me better than I get myself. And then they walk out of the office and they cannot help but take parts of you that are good and healthy and honest and loving and vulnerable to the right people. What really happens as they internalize is that they begin to change their values and change their taste and change their preferences. I've seen it a million times in adolescent work, where because the therapist did it right, they walked out and then they'll come back and they'll say, you know, so-and-so asked me to go ditch school and to be mean to other kids. And I thought, it felt great to me a few weeks ago. It doesn't feel great to me now. Why? Because they've taken in your warmth and your structure and your values in sort of a non-judgmental way. And there's a vacuum there where health should be. And they put you in there and they see life a different way. So be that, and don't just act it, but be it inside.
Good.
How are we doing on time, Mike? I want to make sure we respect our friends' time.
Yeah, so we just have about 4 minutes left. This is our last slide, and then we have maybe one more question if we have time.
All right. Don't fuse with need or rebellion. Remember, we're operating from technical neutrality. We talked about that before in the last webinar. Navigating with equidistance from all aspects of the client's internal self. And the reason I said that then, and I'm saying it now, then I talked about it more theoretically, because that was more of a conceptual time 2 months ago. Now I'm talking about it more in a practical way. They're going to try to have you ally with one or two things. They'll have to ally with ultimate freedom, and why shouldn't I do anything I want to do? And the codependent therapist will go, yeah, everybody needs to do that. Well, no, that's not true. So you're allying with that need, and I mean you're understanding it, you're empathizing with it, but you're not going into that everybody needs to act like you act. But also, the second thing they're going to do, they're going to try to provoke you into being the parent that they can frustrate. They can be frustrated, so they can say that you're just as rigid, controlling, reactive, and don't listen to their parents are. And that's when you move into, these aren't safe conversations you're having. So make sure when you hear them, and this is why, when in doubt, guys, attune. You're not agreeing with any kind of value stance. Sound like you really want your parents to go live on an island so you can have freedom and have parties all day. That's just attuning. Or sound like you really want me to kind of throw up my hands and say, I don't know what to do with you because you frustrate me so much. And no, that's really, I understand that. There's probably some pain underneath that. You're just attuning to it. So stay out of the parent's all right or the child's all right, impulse is all right, defiance is all right, and stay into understanding. It works miracles.
That's great. And I think one of the big thing that I've learned from you is just with that attunement process, you've mentioned a couple times today, you're not always going to get it right, but that's okay because it kind of leads you in that right direction through the attunement process.
This is really good, Mike. You can trust that among all the acting out and the craziness and that sort of thing, there is this part of that adolescent way inside that's saying, I really do want you to get it. I am hopeless. My parents either don't get it or won't get it. No, and my friends, I know that I've got friends that aren't good for me. There's this health-seeking part that's just saying, please, I'm going to fight you like crazy, but get it. If you can tune to that part wants to ally.
Yeah. Well, John, in 60 seconds here, there's a question. A therapist that's working with a local team to build a home for 18 to 24-year-olds coming out of sex trafficking, and just want to know, does your model work with complex trauma, with people with broken attachment and shattered separation stages?
Absolutely. The only thing I would add to that, and by the way, thank you for what you do. We see a big need there, so I hope your vision has great legs. Is I would add to that, this model works because it's an underlying characterological foundation. Just make sure you understand the PTSD and the complex trauma and sometimes double trauma on top of that. You've got to have the training on top of that. A lot of times you have to attune, work out the PTSD, and then underneath that go to the characterological depending on severity. Attunement's got to start, and then getting them out of the traumatic, fight or flight or freeze or fold, then to the characterological stuff. That tends to be the sequence, but they're hand in hand, work very well together.
That's great. Well, thank you so much, John. This has been fun, and we appreciate you joining us today. I have a couple closing comments here, and John, of course, we're thinking of you and praying for you and your family. We had comments come in on the question dashboard here too, just that people are thinking of you and your family and the loss of Barbies. So our thoughts and prayers are with you. I want to take a moment here too to just introduce, like I mentioned, Madeline is here with me. She's our new admissions director. If you have questions about Compass Rose or just want to know anything about just how we incorporate John's model here, if you'd like to see the place or schedule a tour or anything like that, we have Madeline's contact information for you there. And then, of course, don't forget our next webinar, the third one in this series, underlying characterological issues that drive behavior. So John will join us again November 1st at 2. And again, the goal of that one will really be to dive into looking at these underlying characterological issues, attachment, separation, integration. You've heard him reference those things today. So we really want to go take a deeper dive into that next time. So
yeah, guys, don't get stuck looking at the symptom. Get down to the root of it. That's what we're going to do in November. Yeah.
All right. Well, we look forward to you joining us again. So thanks, everybody, for joining us today. Have a great day. Thank you, John.
Take care.
Thanks, John. That's fun.
Yeah.